Mildura Community Forum relating to our current management of the COVID pandemic. My name is Terry Welsh. I'm the Chief Executive Officer of Mildura-based Public Hospital, and it's great to join with you all again. These are really important sessions as we continue to learn information, adapt to the changing guidelines and rules. And again, we've got a tremendous panel today with Jerome Weimer joining us, along with Bruce Boland and also Dr. Kane Treble, who will be here to answer our questions. I want to remind everyone this is a recorded session, so please just be very mindful of that. And it's also being streamed through Zoom, which we're on now, and of course stream and connected through Facebook as well. So I thank everyone for joining us today. I want to introduce our Mayor, Liam Wood, who's going to do Acknowledgement to Country. Welcome, Liam.
Thank you, Terry. I'd like to acknowledge the traditional landowners and custodians of the land on which we are meeting this afternoon. I pay my respects to elders past and present and celebrate and respect their continuing cultures and acknowledging the memories of their ancestors. Good afternoon, everyone. My name is Liam Wood and I'm the Mayor of Mildura Rural City Council. I welcome you all this afternoon. Thank you for joining us for this important conversation and the current COVID-19 situation our community is facing. Welcome to everyone watching the live stream via Facebook and to those here in the virtual meeting room. I'll now hand you back to Terry Welch, CEO of Mildura-based Hospital, who will chair today's forum. Thanks, Terry.
Thanks, Liam. Great to have you here and appreciate your effort in the COVID management. Just a couple of things that we've done all through the forums. First, please of all, I ask everyone on Zoom to please just be on mute if you can. If you're not speaking, it's really important so we don't get feedback like the train running behind me as I speak. We will be taking questions written through the comments, either in Facebook or on the Zoom channel as well that we're on. And also we've received some comments earlier in the week. We will go through them again as we have in previous sessions after our speakers from that point of view. So please just be cognizant of that. Please, respectful questions if we can. We moderate where we can to help get the answers out that we need. If we have any technical issues, just again a reassurance, we're recording, and from that point of view, it will be posted afterwards as well, just to make sure we cover everything off. It gives me great pleasure now to welcome a great friend of the Northern Mallees. He's been with us all through our pandemic journey in all 4 COVID forums, and that's Dr. Bruce Boland, who is the Director of the Loddon Mallee Public Health Unit, and he'll give us an update on the current state of play. Bruce, welcome and thanks for joining.
Thanks very much, Terry. Thanks for the opportunity. And I'd like to start by acknowledging the traditional owners of the land on which we're meeting today, also, and acknowledging elders of the past, present and emerging, and indeed any Aboriginal people on the call with us today. So as we speak, there are approximately 8,500 active cases recorded within our data systems for the Loddon Mallee region as a whole. Around half of those, or almost exactly half of those, are PCR confirmed. That's our gold standard test. And the other half are rapid antigen, or so-called RAT test confirmed cases that people have notified themselves through the web portal, and we thank everyone who's done that. Of course, we all know there are a lot of pressures on the testing system, and particularly rapid antigen testing, and we know, of course, that will be impacting the numbers we've got on the system. In all likelihood, it's underestimating the total numbers in the community at the moment. We have 8,500 as we speak in Loddon Mallee. When we then turn to specifically Mildura, we have just over 1,400 cases active at the moment in the Mildura local government area overall. The vast majority of those are, of course, in the Mildura city itself. And again, about half of those are PCR confirmed, and around half of those have been self-identified through rapid antigen test notifications. We've been seeing a fairly consistent number of cases in recent days being identified across Mildura, but of course a lot of that has got to do with the availability or lack thereof of testing. And we've seen broadly between somewhere like 100 to 200 cases each day of the last week or so in the Mildura local government area. And similar to what we've seen across the region and across the state as a whole, there's definitely the largest number of new and active cases are in the 20 to 29 age group, then the 30 to 39. So a very large part of that, about a third of all cases within that younger adulthood kind of age group, in contrast to what we saw before Christmas, of course, which was very much focused on children and young people, particularly children at that point who were unvaccinated in primary schools. I'm sure we'll be coming on to discuss that booster program. And with the returns to school, of course, we would anticipate, of course, there will be a significant transmission potentially occurring in that cohort as vaccination levels obviously increase, but transmission will come together as people come together with a new school term emerging. I'm sure we'll come on to discuss that. One of the most effective things that we can do to control this Omicron spread is the key issue of booster vaccinations. And obviously, as has been precised by the Premier yesterday, the focus on that booster vaccination, not just as being an optional extra, but being a mandated part of the vaccination, not just for our core workers, but indeed for the general community, and the vaccination blitz, which is commencing this weekend, being an absolutely key piece. And we see that day by day within our hospital statistics, within our hospitalizations, within our intensive care units, and sadly, in the instances of deaths, where it's still the case that the majority of those deaths and severe outcomes are associated with people who are unvaccinated or only partially vaccinated. We know that boosters make an enormous difference to the severity of Omicron, despite the fact that, of course, it is less effective against stopping the spread. So we're seeing a large number of cases, but with great progress in boosters, we are seeing a real strong response on top of, it's tough saying in Mildura, a fantastic job. Over 95% of the whole census population has been vaccinated in the Mildura area. We've now got about 1 in 4 of all adults have had a booster across the state, and about half of all over 70-year-olds, who, of course, in that most vulnerable cohort, have been vaccinated across the state. And similarly in Mildura, similar sorts of rates in the area. And that's going to be a fantastic way of stemming that tide of severe infections, which I know has been confronting Terry and many other services in the area as cases and hospitalizations inevitably rise, just purely because of the size of the wave of infection as it rapidly spreads across Victoria and across Mildura. So fantastic work on vaccinations to date. We know there's lots of challenges to come, but that booster jab really is one of the most effective ways that we've got to control the tide of severe illness in this particular pandemic wave. Thanks, Terry.
Thank you again, Bruce, and your leadership has been amazing through this whole journey. I thank you very much for that. Great to welcome back Jerome Weimer as well. Jerome, of course, is our COVID-19 response commander for Victoria and just puts so much of his time into the Northern Mallee. Jerome, great to have you back, and we're looking forward to an update on a number of things. So thanks again for joining.
Good afternoon, Terry, and apologies for not having my camera on. I'm stuck by the side of the road in an outpost of Melbourne somewhere. So I will acknowledge there were Wurundjeri people of the Kulin Nation. I've had my respects to elders past, present, and emerging. And again, apologies for the slightly impromptu non-physical appearance on your screen. Look, I think Bruce has look, I've really covered well kind of the nature and the feeling of the pandemic at the moment. It's interesting if I look at the statewide figures over the last 10, 12 days or so. Obviously, we're seeing numbers of cases, as we discussed last time we had this forum last week, which are just sort of unprecedented in our understanding of COVID in 2020 and 2021. I mean, even today, 20,000 cases. That's the same number of cases today as in all of 2020. We've currently got about 246,000 active cases of COVID in the community that we know about. Again, that's more. It's 50% more than the total cases we had in all of last year, 2021. So just really big numbers. A lot of Victorians obviously currently dealing with COVID. Probably about one in 15 or so in terms of the numbers that we're currently seeing through our PCR testing system and the rapid antigen testing system. Having said all that, what we are seeing over the last 10 days or so is a stabilization at a pretty high plateau. So there's kind of 20,000 to 30,000 cases a day, about half of them coming out of our traditional PCR testing system, the other half coming out of our rapid antigen testing reporting system. And I think, again, that's probably the situation that's moved the most in the last week or 10 days since we last spoke. We're now seeing a lot more rapid antigen tests being deployed across the state. Certainly, we've allocated around 750,000 through our testing sites, and so they've been handed out through our testing sites across the state over the last 10 days or so. We've probably allocated about 2 million of them now through health services, through our Aboriginal controlled health organisations and others to make sure we can start to get these tests into some of our key sensitive settings, key communities. A lot more to come, and there's a lot more rapid antigen tests on the way, but we are seeing a very steady reporting of around half of our active case results every day coming in through rapid antigen testing. So the numbers at the moment are high across Victoria, but fairly stable. So we're not seeing the kind of explosive growth that we saw between Christmas and New Year. And I thought that's a bit of a comfort. But what we are seeing with such a high level of cases is, particularly, of course, a real impact on the health system. And Terry, you'll be closer to that than anybody else on this call. Over 1,200 patients now in Victorian hospitals with COVID, so being looked after in COVID wards and requiring that extra treatment. And as a result of that, we've had to make some really difficult decisions around our hospital system and the health system in the state over the last week or so. So obviously the suspension of elective surgery, Cat 2 and Cat 3, so still very important procedures being suspended is a real hardship to many thousands of Victorians who are waiting for those important procedures to get done. And they might not be urgent, but by God, they're important. And I really feel and like to just recognise the tension, the stress that will be causing a lot of people, and some of them I'm sure will be on the call. So we've had to do that to create capacity and headroom within the hospital system to look after those who need urgent care, particularly from a COVID point of view. But again, that 1,200 number, those numbers are not going up at the rate that we saw even a week ago. We're seeing again a bit of a stabilisation over the last few days. We're hoping if the case numbers continue to trend down and stabilise, that we'll see a slowing down of more people going into the hospital system. We've obviously also seen a significant impact on our testing system. It was pretty torrid trying to get a PCR test between Christmas and New Year. We had some really long delays in getting test results through to people, some long queues at the testing sites. That's eased up a lot in the last 4 or 5 days. So I think average wait times across the state now are down to under half an hour. We're seeing good throughput all of our testing sites, and we're now using a lot of our testing sites we're now using rapid antigen tests at some of our testing sites, particularly for those people who don't have symptoms. We're giving them rapid antigen tests rather than PCR tests. Still pushing out about 50,000 PCR tests a day, but also pushing out about 50,000, 60,000 rapid antigen tests a day. So people are getting back to decent flows through. It also means that we're now getting 85% plus of our results are now coming back the next day. If they're on the PCR system, of course, rapid antigen test results come back within about 15 minutes. So testing's been a bit of a story, but I think that's now is well on the road to recovery. And then of course the other major area of impact has been around workforce, and we've seen a lot of with such high caseload numbers in the community. We're seeing a lot of critical services struggling with workforce as increasing numbers of people are ill with COVID or at home looking after people in their household who've got COVID. In the health system, that's been particularly acute, and we've gone in the last few days. We had around 6,500 healthcare workers across the state who were not able to come to work because they had COVID or were looking after somebody at home with COVID. That number's now reduced to around 4,000. So we've seen that number kind of come down. Actually 3,900 this morning. It's come down by about a third in the last few days, not least because we've introduced new arrangements whereby for those critical workforces, so health services, emergency services, people working in the food industry, they can return to work if they live with somebody with COVID through what we call a critical worker exemption process. So if you're a critical worker in one of those sectors and you are required to be at work to do your job, even if you're a close contact, you can come to work provided you've got no symptoms and you do a daily rapid antigen test, and your employer will provide that. So we've been working closely with the employers in those sectors and starting to roll that out, working well in the health system and other systems, and certainly in our food distribution centres, a few other sectors, it's starting to work quite well. Other changes we've made is obviously we're now, if you're using rapid antigen tests, and they are still not easy to come by, but certainly through the health system becoming easier to get hold of. If you do get a positive result, you are required and really encouraged to register those results on the online Vic portal. What that does is it means you get immediate access to the clinical and welfare support that you might need. So it ensures that anybody who's got a positive rapid antigen test result can immediately flag up if they've got underlying symptoms or underlying conditions or any other concerns or any other support they need. We can get help to you and keep an eye on you as you go through that COVID process. So really important people do that. We've got a really good uptake. I think over 180,000 people have already filled in those online forms and been recorded up in recent days. It's been a really powerful part of our response so far. I've touched on kind of the critical worker quarantine exemptions, those measures in place, and then the final thing, really just to back in what Bruce has been saying, it really is all about vaccination boosters. So 1 in 4 Victorians have now had their booster dose. That's great. We're having a big vaccine blitz over the weekend, so really encourage people to come forward. And of course, yesterday we reduced that interval, the time between the second dose and the booster dose down to 3 months. So if you had your second dose before the end of October, you can now get your booster dose done today. Again, please check on your vaccine certificate on your phone. That'll have the date at which you got your second dose on it. It's 3 months after that, you're good to go to get your third dose. Really key people to do that. It'll really reduce the number of people that end up in the hospital system over the next few days. Terry, that's probably it from me. Because I'm on the road, I'm going to have to shoot off in about 10 minutes or so. But happy to be part of any questions and discussions. Thanks very much.
Thanks, Jerome, very much for that, and a really comprehensive update. There are a few questions we might come straight to you then, and then certainly Bruce and Kane Trevor will be able to cover off a number of the others. Have you got an update for the community up here in terms of the extension of those exemptions into other key industries? I know it's been announced, but if you can just talk that through, please.
I can, yeah. No, thanks, Terry. So look, so we have exemptions currently in the emergency services sector. So hospitals, ambulances, fire, etc. We've also extended it into food production and distribution. So really food distribution centres, supermarkets, and those sectors. Education will become one when the schools start going back, and certainly early childhood centres will be included as critical workers, as well as utilities. So power, energy, waste treatments, etc., are also part of that sector. And finally, transport and freight distribution. So particularly truck drivers, we're seeing real shortages of truck driver availability in many key sectors. I'm sure it'll be an issue up in Sunraysia at the moment, given the huge amount of agricultural freight we've got going through the area. So those are all sectors that are included in critical industries. It does require, though, the employers in those industries to really work with their workforces. So if there's employers on the call, if you work in those industries, you think you're eligible, again, check the details on our website. What we're asking you to do is to then, if there are critical members of your staff who need to be at work, so I'm not including lawyers and accountants, but people who need to be on the tools in the workplace doing those critical things that keeps food on our table and that keeps the lights on, then you will be required to provide those workers with rapid antigen tests. Make sure they can segregate from other colleagues in the workplace. So have separate workplaces and workstations and so on, separate meal breaks and those kind of sensible measures. Anyway, there's good news on our website. If you're not sure, speak to your whoever you normally deal with in the Victorian government, usually probably in the industry department, who will give you real clarity and guidance around how you can get support. And if you need access to rapid antigen tests for your workforce, they can work with you on that as well. As I said, we've had around 8 million of those rapid antigen tests arrive so far out of an order of 200 million that we've made. We're expecting many more to come through in the days ahead. Thanks, Joe.
Yeah, great update. Thanks, Jerome. I appreciate that. Just going to jump around a little bit just while we've got you then. A number of questions have come through, obviously, in that preparation for school, and I appreciate you're not the Department of Education, but questions around so there's a number. One, is it safe for the 5 to 11s to have the vaccination? I know what your answer will be there. So flowing on from that, but that has been a constant question. Flowing on from there, what about the children who don't have the vaccination come the start of school time?
Yeah, so look, so is it safe? Absolutely. Look, I'm not a clinician, and probably Bruce can speak to that better than I can as a doctor. But in terms of 5 to 11, I think we've seen about 120, 130,000 5 to 11s get vaccinated so far. Well, first dose with the pediatric version of Pfizer, it's a special pediatric version of the vaccine. And that program's gone really well, really good uptake across the state. And obviously we're expecting a couple more big weeks ahead, particularly this week and next week before school. There are lots of appointments available, certainly in the state vaccination clinics, but also in the GPs and pharmacies. So I'd encourage you, by all means, do your research, but please make an appointment and get your kids done. In terms of how many kids will have it done by the time school starts, kind of depends on demand. We would certainly hope to be in a position where by the 1st of February we've got 2/3 of kids through their first booster dose. If there's certain capacity to do more than that, but I'd hope to be at around 2/3. there's no vaccine mandate, so there's no requirement for kids to have had their vaccine before going back to school. But obviously, we are expecting to see case numbers go up when the schools go back in. We saw the same thing in term 4 with Delta when we went back into schools in November, December, we saw a real spike in cases. We should expect that again. We don't believe that we will believe that a lot of kids are at risk of getting COVID. If we get the vaccines into them, that will also minimize their risk of getting any serious complications as a result.
Great, thank you. And then one more, and then we'll let you go, and really appreciate you being here. It is exactly around that question. One was submitted earlier around the increase in case numbers we saw before Christmas. And this is a question about, is it safe to send their children back to school, and what protections are planned to make schools safe? Have you got an update there for us, Jerome?
Yeah, great question, Terry. And look, absolutely. My kids are a little bit older now, but I absolutely do feel for parents that are thinking about sending their kids back to school. So look, I think there's been a huge amount of work done by our public health teams and education teams, air scrubbers and air purifiers in schools, lots of plans in place to do, I think, as much as they can outside of schools. There's been sunshades fitted at many schools to enable more activity to be happening outside during the summer and autumn months. So lots of practical measures to improve the safety of schools, particularly around cleaning and sanitation and those sort of things. So I think there's a lot of practical measures in place there. Obviously, the vaccine boost is very important. We're also, there's been a national cabinet meeting this afternoon. Obviously, I wasn't at that, but my expectation is there will be announcements tomorrow and next week around other measures in place to ensure we have a good view of the virus traveling around schools and how we manage it. So there will be a number of other measures that I think our parents will feel a little bit comforted by. But what parents can do right now is get their child boosted and make sure that children are familiar with using masks and all those distancing and hand hygiene regimes that unfortunately all of us have had to get used to over the last couple of years.
Thanks, Jerome. And I said it was your last one. I'm going to give you one more just to reconfirm, and welcome to the Happy Turtle team who have joined us, a local childcare centre, Jerome. If in early childhood centres we need educators to work, it's about the supply of rats. Now, You've been really clear that each government sector would be able to provide the rats. Is that correct?
Absolutely. So, and good day to the Green Turtles. So no, absolutely. So there will be, if you speak to your education department minders or whatever, however you describe them, the people from Melbourne who go there to help, then do please give them a call. There are arrangements in place. There will be rapid antigen testing available for critical workers in the education sector, including early childhood. I'm sure they'll make those arrangements for you. Okay, thanks, Jerome. Okay, we might let you go. We know you're on the road. Thanks for joining us. I'm going to bring Kane Treble and Bruce Boland back in. Thanks, Jerome. Great for joining us. Thank you, Terry. Pleasure to you, buddy. Bye-bye. As I welcome in, I thanks Happy Turtle for that clarification, and we're able to tick that off. So great news, I think, around the rat tests, everyone, from that point of view. Bruce, welcome to you. Testing and testing requirements, and there's been access challenges. Have you got sort of an update what the next week might look like for our community, and in particular, obviously, people looking to get back to school?
So obviously there have been a lot of challenges, particularly acutely over the Christmas period, as everyone will be aware. We are gradually getting back on track. And I've got to say, Barrett Smith in particular doing a tremendous job in Mildura, making sure that there's both PCR and rapid antigen testing available for people who are symptomatic or who are household contacts. And that continues to be the case. There is extraordinary pressure on many different workplaces. The hospital being one of those, of course, as Terry's acutely aware, along with residential aged care, and obviously with kids returning to school, that'll be another site. So all of those pressure issues are being worked through. And as Jerome said, obviously there's a lot of different departments involved in those conversations with those service suppliers. From the public health unit's perspective, we do have some capacity to be able to, when we're dealing with major outbreaks, support on a limited scale those facilities where there are significant outbreaks occurring. Obviously, we accept at this point, we're not trying to eliminate the virus, we're trying to stop its spread, particularly in those really sensitive settings where we know there are more potentially vulnerable people or where there are critical industries involved, and we work through that on a case-by-case basis. But I'd have to say, in summary, basically we are seeing improvements in supply, and that should continue in the coming weeks. One of the frustrations has been that, to everybody's surprise, One of the things which is disrupting supply at the moment is, of course, very sadly, the Tongan volcano, which is leading to some delays in transport coming from China for a whole bunch of different things, including in some instances, as I understand it, rapid antigen tests as well. So these are some of the unforeseen circumstances we all have to work through. But regardless of that, I think we are seeing improved supply currently, and we anticipate that to continue to be the case in coming weeks.
Bruce, thank you for that. There's a question here specific around the rats. We might just continue in that for a few minutes there about when can pensioners expect to have rat tests available as promised by the federal government. I'm not exactly across that. Are you familiar with that, Bruce?
Yeah, I'm not so familiar with that particular one. What I can definitely say is for anybody who's symptomatic or for anyone who's been identified as a household contact or a household-like contact, they can access those rats through the state testing centres, and particularly through Barrett Smith currently, and we're continuing to work with Barrett Smith on that. Obviously, supply is more limited through general pharmacies and elsewhere, but certainly that is available through state testing sites and through Barrett and Smith as well, who are doing a terrific job locally.
Yeah, sure. Thank you. Another question around testing this time. Do you have to have a test on day 6 when you are in ISO without symptoms?
Yeah, so if you're a case, then yes, you need to do that. I mean, I think advisedly, honestly, I would be doing it. There's no disbenefit to doing it, and I would certainly be recommending to do it. We recommend that for both cases and for contacts. It's particularly important for contacts, certainly. In the vast majority of instances, by the time someone who is a case and has been identified as a case and knows they're a case and has symptoms, by the time they get to 6 days, absolutely, they could well be well past their usual infectious period, but there's certainly no harm in taking that additional rat at day 6, and certainly for household contacts, that's mandated, that's required as an action.
Okay, we're going to call in you Dr. Treble here. We've got a clinical question. Bear with me, it's a little bit long. My 6-year-old was vaccinated last Thursday and has now come down with a cold, started 2 days with a cough. However, we got a rat test and the rat test was negative. And should they retest if negative?
Yeah, excellent question. And unfortunately, we do have other viruses circulating in town at the moment, and there's a good chance that it may just be one of the other common coughs or colds going around. It is possible as well. There could be some side effects from vaccination, but depending on the symptoms, I didn't catch them all there. Probably just coincidental timing, to be honest. Normally it's a grizzliness and a bit of a sore arm, not too much more than that. In terms of repeating testing, the rapid antigens are good tests, but they're nowhere near as great as the PCRs are. They are the gold standard. And so if there is any concern about it being a potential false negative, I'd recommend repeating the rapid antigen test either the next day or 2 days after, where the load of the virus in the body might be a bit higher and the test might be a bit more accurate in terms of picking it up.
Thanks, Kane. I appreciate you covering that off, and I hope that answered that question. Bruce, I'll come to you. We hear that vaccinations are the best protection for us all. Will there be a coordinated approach between schools and health in terms of making vaccinations available in the school environment? Have you got a lens on that at all?
Yeah, I mean, obviously at the moment, all state vaccination places are open for business and they're taking on bookings, and obviously over the Blitz weekend there's going to be some capacity as well for walk-ups, but we'd be encouraging bookings. Obviously is preferable. It enables us to manage the flow of people coming into the system so much easier. So that's currently available. There are a number of specific sites where there will be some particular activities to enable boosting activity at primary schools. We have one happening in Bendigo. That is at a very limited number of sites where there has been proceeding in the general community lower levels of vaccination. So it's certainly not happening in every school, and we would be actively encouraging people to use those booster facilities through either your general practice, through your pharmacy, but particularly through the state-run vaccination services. And my own kids were vaccinated only just last week through our Bendigo site, and had a really easy and fluid experience. There is walk-up capacity, but we'd encourage everyone to book in.
Thanks, Bruce. Can you just give an outline of what the Blitz is going to look like?
Yeah, in essence, it's going to involve working longer hours at the vaccination clinics, the state-run clinics. So going from around 9 o'clock in the morning till 8 o'clock at night. Obviously, we've got a large number of bookings already made, but then also having that additional capacity to do as much walk up as possible. Although obviously, at the end of the day, we've only got so many vaccinators and so much time. So we do appreciate everybody trying to book in if at all possible, but there will be that ability also for those people who haven't had a chance yet to get their booster to come in and get that. And I think particularly, obviously children are a priority, but as everyone knows, severe illness is much less likely in young children. There are lots of benefits of vaccination, but severe risk is happily very rare, and obviously vaccination will make it even rarer. Particularly for adults, however, booster jabs, and now that the interval between your last jab and your booster has dropped to 3 months, we would definitely be encouraging people to come forward and get their booster jab as soon as possible, really. It certainly is effective even within a week. There's good evidence from the UK now showing that even within a week, we see a significant reduction in risk of severe illness, hospitalisation, and more severe outcomes than that as well associated with those boosters.
Thank you. Probably a question I should have asked Jerome, but he's gone. So I just wondered, Bruce, if you know about any of the financial support programs that are available for small business, for example, who are noticing a drop off in either activity from people turning up because of the current situation or workforce shortages.
But yeah, I'd have to defer to Jerome and other departmental colleagues, but my understanding is that, yeah, there is unfortunately at this point very limited, certainly state support. I think there is still possibly some Commonwealth programs potentially in place. I'm not 100% across that, I'm afraid, but I know it's been a major issue of concern, but unfortunately, there's minimal support, unfortunately, at the moment for those businesses that are impacted.
Thanks, Bruce. I'm going to come to the CEO of Mildura Development, Brett Millington. He's got an update for us as well. Brett, welcome. Great to join us.
Yeah, hi Terry, how you going? Yeah, look, very true what Bruce just said. Currently, there's been no announcements in terms of business support in that regard. Typically, if there is anything available, it's for the individual who might be otherwise not have access to special leave or otherwise. So we're still obviously lobbying into government to try and see if we can get something in terms of that support. You know, we've had evidence of 20 to 25% of businesses, of staff absent from businesses. So certainly a tough time for small business at the moment.
Thanks, Brett. Appreciate you joining us and being able to cover that off. Tremendous. Bruce, I've got another rat question for you. Funny calling things rats, seriously, but rapid antigen. It's around essential workers and they're acknowledging the process. Their concern in the question is about how does it work when they can't access rat tests? And I think that's been the challenge all the way through. Are you confident that sounds like we've got a flow coming up to the Northern Mallee?
Yeah, absolutely. I think those issues are acute for many different businesses and workplaces. They've been working through that on a case-by-case basis. And I've got to say, businesses and workplaces that do need to supply those rats have been doing an incredible job of making that happen. Obviously, the key, if you're required to take a rat test, it's a key thing to work through. And of course, we work with businesses in the context of outbreaks and so forth to ameliorate those key issues. But probably more important than that is monitoring your symptoms. Rat tests are very useful at ruling people in when they've been with symptoms. Yep. For people who are asymptomatic, meaning they have no symptoms, they're actually not terribly, they're not as accurate as the PCR test. So if you're struggling to access rat tests, by far the most important thing to do is, if you are symptomatic, stay home. That's the single most important thing you can possibly do to stop the spread. Yes, there are other bugs in the community, but with this Omicron wave and it's spreading the way that it is, if you're symptomatic, stay home. And a rat would really only just be confirming that, to be honest. And obviously we continue to work with businesses around those issues of access to rats to enable that surveillance, particularly for essential workers.
Thanks, Bruce. And Kath, in the Zoom chat, Kath Murphy, welcome. Mildura Primary School is a pop-up vaccination centre. We'll post this on the 4th of February, commencing 4th, the 5th and 6th of Feb. Great stuff. It will be promoted out and it'll be bookings and walk up. Thanks, Kath. We'll make sure we get that out on the relevant socials, however that happens. Bruce, a question around the testing result numbers now. can you please confirm that the number of cases reported daily for Mildura and the Northern Mallee does not include rat positive tests?
So we are distinguishing between probable cases and confirmed cases. The numbers that are getting routinely reported incorporate both. So they're assuming both that PCR confirmed cases and rat cases are included within that. But what we don't know, of course, well, what we do know is where people have taken that rat, it's come back positive, and they've gone on the system as they should, and they've done a terrific job in doing that in huge numbers to notify the state to notify the state system. So they are, in reporting of the numbers, all treated as both confirmed and probable in one large number. New South Wales wasn't doing that for a short time, but then has done that. And obviously it does make a very big difference to the numbers, including probable cases.
Sure. The commentary that Jerome provided, and it's again a comment we've had earlier, what is your sense in terms of the number reported versus in the community? It's a ballpark, I know, but what
I mean, it's a matter of a great deal of speculation. I mean, I think, you know, in general, I think amongst myself and the other directors and in our conversations with our epidemiologists, we work on a rough assumption that we probably have around twice as many, if not some orders of magnitude higher than that. If we look at the test positivity rates at the moment, they're probably standing at about 25% to 30%. That's down a little bit, and that is one of those indicators which suggests that we may be over the top of this part of the pandemic wave and coming down a little bit. That's promising. But with that level of test positivity, it also indicates that there's probably a great deal of under-ascertainment, under-identification happening in the broader community. The WHO puts out a standard where you're looking for something between 1% and 5% or so as your test positivity rate, and certainly we were back there. Back in the day, we were back in the day a month ago. It feels like a century ago. It's COVID time. It easily catches up with you. About a month ago, we were tracking it sort of between 1% and 5% regularly. We've been well over that, and that indicates we've got several orders of magnitude higher in the general community. Happily, that's not translating into hospitalizations and severe infection, and that would be consistent with what we know internationally. In a highly vaccinated population, yes, you may get infected, but the likelihood of severe infection is much lower, and it could well be that people are asymptomatic or having very mild symptoms are the ones that we hope are the ones that aren't locked into our system, as it were.
Thanks, Bruce. Just confirming for everyone, we've got about 250 screens on us today streaming, so a terrific attendance again, given the time of day. There's a question for the hospital I'll answer in terms of patient numbers. We don't do daily commentary on patient numbers, but I will tell you today, as we speak to you, we have 3 people in our ICU with COVID, 1 on a ventilator, and we have 5 in our COVID ward, and we have 6 in our SCOVID ward, and some people being assessed as we speak in our emergency department. But that is such a fluid number, we just do not provide them day to day. But there's a snapshot, if you like, for the purpose of today. Kane, I want to come to you as a GP. People have just asked a few questions in terms of any other advice you feel about preparing children to go back to school.
Yeah, look, I think common sense goes a long way, and a lot of households will have to kind of look and assess for themselves if they feel it's safe and ready and appropriate for their family. But generally speaking, we are heading towards that living with COVID kind of mindset. And so I think acknowledging all the precautions that are being taken at the moment, I think it is reasonable to be sending kids through to school. If we can do things like vaccinate, it adds that extra layer of protection, not just for the kids, but also for the families and all the people around them. I know it's very difficult to get in to see GPs at the moment, but it certainly is the best idea to book in and have that chat and see if there are other things that need to be taken into consideration. And certainly if there are specific concerns, I'd be trying to get that appointment sooner rather than later. Again, also worth potentially touching base with the school to see if there are certain measures that could be put in place, if there are specific requirements. But generally speaking, I think everyone's doing a fantastic job at getting everyone prepared for heading back to that environment.
Thanks, Kane. And it does appear that our questions have slowed down, I think, which is a positive. So not the normal volume where we can't get through them all in the hour. So look, there's been no more come online that I can see sent through to me from Facebook, no more on Zoom. So again, I thank everyone for joining us. There are a few things I just want to wrap up with. And first of all, from a hospital point of view, everyone knows we have been, placed ourselves, but as part of the state in a code brown situation. Just to give the reassurances we've done online today, you'd be amazed how calm this organisation is while it works through this major event. The team here are doing an incredible job, and the key services we are focused on keeping key services open, and that is our absolute focus. So I just commend the work of the team here at the hospital. For a bit of self-indulgence for one moment, we also want to thank our key partners through the Northern Mallee Pandemic Response meeting, which happens every day. We connect heavily with partners. We know what's going on when we're responding very quickly. Today, there's been sharing across this region of PPE, for example, which is just so important to keep our agencies safe in amongst a range of other things. So I commend everyone for that. A lot of agencies are getting a lot of publicity, but I want to call out to SMEC today. The work they're doing is amazing, just amazing. A bit behind the scenes, we need to bring them forward at some point and give them due promotion, but they are the backbone of a huge response in amongst many others, but a lot of us get a lot of publicity. So to the SMEC team, I say congratulations. We pass on our condolences and thoughts to everyone from the Tongan community. Obviously with the weekend's events, we just want to note that as well. It's been, really tough on a lot of people, and we're thinking of you. So as I wrap up again, I extend nothing but thanks to everyone for joining us, to Ben and everyone from council who have coordinated this again with many teams. Thank you for that. And thank you to the community for really being so responsible in the way we're dealing with COVID. To Bruce Boland, to Kane Treble and Jerome, thanks for joining. This won't be the last forum. We have to keep these going. Information is king. And I'd suggest as we get even closer to the school or into school, we might be doing some more in amongst other things. But again, I thank everyone for joining us, to our Mayor Liam Wood for helping get this sorted today. Thank you very much, and look forward to seeing you on the next forum. Thank you.